This month, many people have stopped drinking alcohol as part of the challenge known as Dry January.
But experts say as the month nears the end, it's a good time to think beyond Dry January and maybe consider scaling back more broadly. Our Dr. Frank McGeorge is here to explain why.
Well, you know, Pam and Karen, a number of people who started Dry January found that they couldn't make it to the end, and that by itself is a red flag. In fact, around 1 in 10 adults in the U.S. has an alcohol use disorder, and many people who began drinking more during the pandemic have found themselves struggling to stop.
Many people who struggle with drinking don't realize that they're having problems.
Those problems can take many forms, says Dr. Scott Winder, a psychiatrist at University of Michigan Health who specializes in helping people with alcohol use disorders.
People will have health problems, relationship problems, social problems, changes in how they perform at work or at home, and these can be prominent warning signs that something's wrong with how we use alcohol.
In recent years, deaths from alcohol-related liver disease have risen dramatically, with adults under 45 hardest hit.
Rates of alcohol-related liver problems increased markedly during COVID-19. Most of the doctors in the hospital could tell easily that there were younger and younger people with more and more severe alcohol problems on their service. It's been tragic and sad to watch so many people struggle like this, and it's really motivated us to find new ways to reach people.
Winder stresses even people who don't have alcohol problems can benefit from drinking less.
There are some general life-prolonging effects of avoiding alcohol, like avoiding or lowering our cancer risk. If people choose to cut down or abstain, they might count on feeling clear-headed, improved mood, less anxious, better sleep, along with some improvement in some of their lab values and how they feel physically.
Now, in 2018, U of M Health actually started a unique clinic that combines medical treatments for alcohol-related liver disease with mental health and substance use care. Now, other resources for people experiencing alcohol-related problems include professional counseling, residential rehab, and recovery meetings like Alcoholics Anonymous.
Yeah. All right, Doc, so for people who were able to quit drinking in January, going forward, what can we do to increase the odds of successfully drinking less going forward?
Yeah, so you really kind of have to think about when and where you were drinking primarily. If it's after work, for example, finding an alternative activity to wind down might help. If it's at parties, alternating drinks with water with a mocktail or non-alcoholic beverage may be beneficial. It's basically all about being more mindful about your drinking overall.
Having a plan ahead of time.
Yeah,
that's for sure. All right, thank you, Doc.
Thank you.